All right, it's Thursday, 8 o'clock. I'm on live. I took yesterday off. Hey, Virginia, two girls. It takes a village. That's the truth. There's a lot of conversation going on out there. You know, people talk, and you sometimes wonder what we're talking about. But you know, we're talking about fertility, and this is a live. It's meant for questions, comments, answers. Hello, Will. Thank you. Kristen Ann. Hello, Danny. Hello, Jacqueline. Maze. Ton. Hello. The keys to happiness. Can I borrow them? Okay. We all really have them. They're within all of us, by the way. You don't have to go anyplace for them. We own them. The key to happiness is like in here, right? Hey, Krista. Hello, Carolina. Cassie, Kristen, Jacqueline, Marcia, Danny, hello, hola, ¿qué tal, cómo está todos? Need to work on my Spanish for sure. Cramps okay after fresh transfer. Some cramps are pretty normal, by the way, especially after a fresh where the ovaries and the uterus are really moving and a lot going on in there, by the way. There's a lot going on in this entire body of ours. It's in constant motion and commotion. Cheese isn't on Kiltz's keto. Well, I do a little bit of cheese. I do some blue cheese, some Parmesan, but you're right, but bacon, eggs, butter, beef, and ice cream, cheese didn't fit into that. If you can figure one out, I'll add a little bit, but I love blue cheese and butter melted on my steak, but I love some salami and Parmesan, Reggiano, and also, I love a chorizo salami. That's the one I love the most, by the way. Brother Ray, I love you. Keto. It's keto. And it's, you could be a vegan, you could be a vegetarian keto, by the way. Remember, it's always one meal a day, like a little snack in the afternoon and your main meal at night. It really, really matters. What is a typical med protocol for someone with PCOS, polycystic ovarian syndrome, aka prediabetes, metabolic syndrome, which is a high inflammatory environment? But it's either Clomid or letrozole with a trigger shot to help you ovulate either with intercourse or insemination, and occasionally IVF, by the way. But I certainly recommend inositol, Kiltz's keto of some form, maybe a little bit of metformin. Dr. Corley likes 2,000. I like 500 if you're going to use it. But the typical for those who are doing IVF would be either a gonal to a little lower dose at 200. But if you're heavier BMI PCOS, you still may need higher doses of gonadotropins in the 300, even to 400 unit range, by the way. I get talking, I get heated up. If someone doesn't want to remove a fibroid, would you still allow them to move forward with IVF? Absolutely. We do a lot of IVF without removing fibroids. You can leave them there. We can evaluate them at the time of the retrieval, give you our opinion. We might add a hysteroscopy, document the scan, and then either plan a transfer, fresh or frozen, recommend a myomectomy. You can always come back for another retrieval and bank more embryos, and then wait about as long as 6 months. I usually say 3 to 4 months for a transfer. By the way, for PCOS, also laparoscopy with ovarian acupuncture, also known as ovarian drilling, by the way. Hey, Lauren. Is HCG trigger better than Lupron? It is not better than Lupron, but those with really low LHs need some HCG. And some people think that maybe a Lupron only trigger for those who don't have a high estrogen may not be as valuable. But really, most of the studies show it works. But I think we're just a little superstitious that we do like to add a little bit of HCG, 2,500 to 5,000. If your estrogen is less than 2,000, 10,000 of HCG. In some cases, we've been talking about 15 to 20,000 of HCG, and I'm really throwing this out there for the first time, but I've seen a few cases where higher doses were really necessary. 3 miscarriages, 2 non-PGS and bad chromosome issues, and last one was PGS tested at 12 weeks. Just did receptivity test. Thoughts on that? So receptivity is looking for, Carista, is looking for endometriosis, which really I think the only way to know it is to see it laparoscopically. I think you could treat empirically with 1 to 2 months of Lupron or Orlissa plus letrozole. Chronic histiocytic intervillositis, CHI, which is an inflammatory condition of the placental bed at every stage, which is an immunologic condition, which may be part of, I think, the biggest problem. So chronic histiocytic intervillositis. Look it up. I'll put it out there. Some new stuff that we're looking at, even some new data that shows that maybe Prograf longer throughout pregnancy, higher doses of prednisone, IVIG, Humira, and Lovenox in the 30 to 40 twice a day may be really valuable, and along with the aspirin 81 to 100 milligrams a day. But so let me see if so the Receptiva test, again, I think looking and treating is the best way to do it. Vitex, Vitex, I'm not a big proponent of, but I just don't use it very much. What can affect implantation? Implantation is affected by inflammation. If we could fix inflammation, we can improve implantation. There may be some other defects of implantation, but most of them are likely related to the body rejecting an implanting embryo due to a high inflammatory environment. This is why the 1 to 1 month of antibiotics, antifungal, antiviral may be valuable. Every 2-week intralipids, monthly IVIG, Humira, Cimzia. There are a couple other biologics out there that people are using that have some really good benefit. How common is it to have a blocked tube HSG tomorrow? You should be good. It's not that common. Most of the time they're normal, but sometimes there's spasm. But we look because it helps, and sometimes by just doing it, it flushes out the tubes, clean things up, and it will help you get pregnant naturally, by the way. We see that happen a lot. Starting IVF, first IVF next week. Should I include lipids? Yes. HCG wash, embryo glue? Yes, yes, yes. Don't forget Kiltz's keto or some keto. Maria Emmerich, Craig Emmerich. Look at those. Ken Berry's almost carnivore, although I saw some asparagus on his plate on Facebook. But for me, it's steak, eggs, butter, cream, ice cream. It's a home run, by the way. Look at, if you go to Amazon and look at Kiltz's Keto Lifestyle, download it on Kindle, you'll get my ice cream recipe, by the way. Be worried about COVID affecting the placenta. I don't know that answer, but, I don't think so, but, there's so many things out there that are probably much more likely than COVID, in my opinion. Wear a mask, wash your hands, we do our distancing, we do all the things that we can do. I think it's a small risk, by the way. Hello, Mabel, Kristen. I am well. Thank you for asking, by the way. And hopefully I won't lose my battery charge. I'm a little low on battery here, but if I run out, we'll come back tomorrow. So we'll go until the battery's dead. Hello, Anna, Griffin, Aaron Oliver, Joey. It's my pleasure, by the way. Can you explain what a mock transfer is? Well, we don't typically do mock transfers. We do the, quote, transfer with a mock catheter at the time of the transfer. We pull out the inner catheter, the good one goes in, and 99.999 it works well. But a mock transfer is anytime, weeks or months before you do an actual transfer, you do a practice transfer. We found that it's not necessary. Pregneol for AMH higher than 4. You can, if you have an estrogen less than 3,000, less than 2,000, you don't have 30 follicles, then some Pregneol, Profaci, Novarel, or Avidril for trigger, I think is good, by the way. Albany team, Ditkoff, Grossman, thank you. Justine, the whole team. Grazie to everyone there. Buffalo, Dr. Chang, D'Souza, and Chris and the whole team. God bless you guys. Amazing. Rochester team, thank you. Syracuse, they're really rocking. Everyone, patience. Thank you. Wear a mask, please, and be really, really, really patient with the team, please. All right. Recommend Myo and dianositol. Yes. Nancy, hello. Have you ever utilized calcium ionophore? No. I don't know. I'll have to look. Maybe. That's a good one. I don't know that answer. See, I'm coming across things. I've heard of them. I don't think, we're doing so many things as it is, but I'll look it up along with the Vitex and bring you more answers on that. Early ultrasound and wait until 7 to 8 weeks. Yes, you can. Wait on the early scans, check your numbers. If you have pain or any problems, go to the emergency room. Abdominal scans might be okay too. We're doing a lot more of those rather than doing the vaginal scanning, by the way. Donor egg, again, even for the donor eggs, the Mach cycle, Mach transfer. Now the Mach cycle of estrogen progesterone has a little bit of benefits, because if you go through all this stuff and your lining isn't getting there good, that can be an issue for sure. They have me on 150 going to 7 minute pure PCOS. That should be good unless you're 200 plus pounds. You might need a little bit more, but if you have a high AMH in the 8 to 10, that might be good. It's a good start, not to overstimulate, but it might take 300. So look and see what it looks like on day 5 or 6, and you could boost it up to 300 if need be. Talk to the team before you do that, by the way. All right, Gina Smith, hi. Mini IVF, how many eggs is a good number? 2 to 5 is a good number, by the way. I got all these bird nests, robins, right outside my porch here. I don't know if you could hear them. They're really awesome. And the mother was sitting on that nest like forever. Hey, Shay. Hello, Ramirez. Laura from Ohio. Latanya, hello. What's the determining factor on abdominal retrieval versus vaginal? Dora, hi. We typically we'll always do vaginal first, but I have some people you can't see it vaginal, you go abdominal, you get it. So and I've had some people that the only way to get it is abdominal. And quite often with the right anesthesia, we can push those ovaries down and get them without a problem, by the way. 2 girls, got that. PCOS went through another fertility clinic, had 3 biochemical pregnancies, IUI and InvoCell. Any recommendation for my first IUI at CNY? Keto, LDN, CBD, Ovasitol, and laparoscopy, ovarian drilling. It's another one for sure. And it might be a letrozole 10 with 150 of Gomel to 200, so kind of a mini dose. And think about converting an IUI to an IVF, maybe better. But don't forget the immune protocol with a little bit of steroids, Lovenox, aspirin, intralipids, and that should be a good start. If you go to the website, cmyfertility.com, if you download, you go to the patient portal resources and look at the simple guide. There's a lot of good information there and a good list of things to look at. When will the Atlanta clinic be doing IVF? 2021 is my go. No matter what, I start doing construction and getting ready. It takes 6 to 9 months to do it. But right now, Buffalo, then we get Colorado moving forward, and we go from there. And we need some more help. We need some nurses with OR experience in Syracuse and likely Albany, by the way, because we are really busy. And my team, I don't want to burn them out. They are amazing, and we need to have a nice flow and good team members, and grateful to everyone. And the labs, the IVF labs are doing amazing. Remember, we're seeing so many people with different problems. Some are going to get a lot of eggs, some a few, some no fertilization, some great fertilization, some day 3, some no day 5s. There's a lot of variety in all this. We're an open book to the world. We share everything. And so when you do that, Everyone has an opinion, but I can tell you, rock solid. They're doing an amazing job. All of Ann, Allison, Olivia, the whole team, and I'm Deb. I can't mention everyone, but I'm really proud of the IVF andrology, embryology teams at all of our locations. So gratitude to everyone. Stephanie, extra benefits of level 4 immune versus level 3. IVIG, Humira, and LIT therapy. Leukocyte immunotransfusion, Markham Fertility, or Nogales, Mexico, which are kind of hard to get to right now. But they're bigger guns. I think they're valuable. Higher dose and more frequent IVIG, and Humira the same way. And the Plaquenil Prograf, although we're using them separately, they both have a lot of value in reducing inflammation, by the way. Syracuse office in the morning. Jared, we'll see you guys in the morning. Dr. Luthringer and I tomorrow morning. Dr. Chang was here today with Dr. Luthringer. Awesome job. Put a fertility clinic in York, PA. Surgical tech, and would love to do fertility stuff. We might need your help, Kim. You know, we have our team members working from all over the country. A lot of it is just in the support we're doing right here. And the more support we do, helping share eggs, sperm, embryos, and a uterus. You guys are really sharing a lot of really great knowledge. Thank you. And the more we do it together, and we're all learning. And again, I've learned so much from Dr. Vidali, Dr. Braverman, Dr. Kwak Kim, Dr. Beer. So many that are here today and aren't here today have given us so much information and how to do better and learn. Milwaukee coming. AMH is 0.1533. Trying my own eggs. Okay, Kara. It's always worth doing whatever you want to do and try. And I say do or do not. There be no try. Master Yoda, as we know. But here's where keto comes in. My rock solid keto. No vegetables, no fruit, no fiber. Fatty red meat, better. Little bit of fish and chicken, duck. I won't say geese because Larissa is very sensitive to geese and goose liver. But it's the fat and get rid of the plants that are killing our eggs, sperm, and our thyroid glands are being destroyed by plant antigens, phytochemicals, and I know it doesn't make any sense, but I'll bet $1 billion. And I've seen AMHs come up, especially on those women that are younger, and there's a lot of inflammation in the bowels, in the belly, by the way. Let's see. Hi, Jay, Christine, Brittany, Ashley, hello. Roseanne Graves, hello. Heather Lynn. And I apologize if I mispronounce little dyslexic guy here. Don't forget Kiltz's ice cream, Cheryl. It's good. And thanks for those shout out, by the way. You know, I see them and I sometimes don't get to them, but we miss you guys. And maybe I'll be down in Orlando, I think, for some educational stuff next week, Wednesday through Monday. And I'm off, actually, Wednesday through Tuesday to have some personal time. We all need to rejuvenate and get back to wherever we need to go, right? It's all crazy and amazing, this beautiful universe we live in, right? Chromosome miscarriage this week. We use donor sperm. Happen again with other 6 embryos we have frozen. All right, so a chromosomal miscarriage still may be related to what's going on in your body that causes the chromosomal abnormality and the miscarriage. That's where my diet comes in. But, you know, there's risk to all this. But CHI, chronic histiocytic intervillositis. That's a long tongue twister. Basically, placental bed and uterine inflammation. That's really what it is. Chronic and acute. This is where the month of antibiotics, the silent C, chlamydia they call it, but I think it's just chronic inflammation, whether it's chlamydia or bacteria, yeast, or other microorganisms. I recommend the 30-day antiviral, antifungal, and antibiotic. And this is where a hysteroscopy, DNC, and laparoscopy, flush and clean things out, can be helpful. And the PRP, platelet-rich plasma intrauterine, high volume. Thank you, Dr. Verdialis, for that one. And don't forget, Dr. V does a Spanish live, I think on Wednesday or Thursday, and I hope we try not to like step on each other, but she really shares some amazing things, by the way. August, September retrievals. Let's see, Pregneal for a higher AMH. Yes, you could still use it. Depends on the estrogen levels, not just the AMH, by the way. Sorry, I'm just like so thirsty about this time as I'm talking. Fish oil tablets. Haven't used them. Fish oil, cod liver oil, omega-3 fatty acids. Remember, it's the fat. When you eat the fat, because remember, we're made of fat. Every cell is made of fat. The mitochondria burn and utilize acetyl-CoA that is chopped off fatty acids like infinitely all day long. And if you don't have fat on your body, it's not good for you or reproduction, by the way. Medlist did include Prograf. They said for me to start it tomorrow. Didn't have it. Also sent a message to the portal. We can get it started even after retrieval, by the way. Either do the Prograf after and then the Plaquenil after pregnancy, although more and more I'm getting more information from Europe especially, where they're using Prograf longer in pregnancy with good results, by the way. Understand pros and cons of fresh frozen transfers. If you can help explain it to me, all the better. Technically, someone wrote a paper, said frozen's better, and everyone went on the bandwagon. Then another paper was written and said, maybe not so fast, everyone. But basically, if your estrogen progesterone is elevated at trigger, especially over 2 to 3 on the progesterone, we recommend a freeze-all. But if you have enough embryos, I've seen plenty of pregnancies. It's not a no pregnancy. It might be just a little slightly lower. If you're doing PGS testing, then yes, you have to do a freeze-all, by the way. But it's not a straightforward answer. We individualize it. It depends on your numbers. I always say plan afresh. We can always convert it to a freeze-all. Dr. Ditkoff loves doing fresh transfers, by the way. Let's see, pros and cons. Thank you. Great information. It's our pleasure, Claudine. It's a pleasure, Mary. And I so enjoy meeting everyone. I love if we do FaceTime or Zooms or anything when we do videos, I enjoy it, but I'm also okay with just on the fly in the call. Protocol 225/75, 7 days. Should it slow down at letrozole, lower dose? Should I slow it down at letrozole? Maybe, again, we do a lot of 225/75. It does well. You could add the letrozole or go to 150/75. Maybe 2.5 to 5 of letrozole can help a little bit. But if it's sometimes when we say day 7, it might be day 7 of meds, but it might be day 9 of 10 or 11 since your menstrual cycle. So it's not always straightforward in what is the right day, by the way. Keto for inflammation is the very, very, very best. I've seen more pregnancies, more inflammation go away on Kiltz's keto or some close keto like Emmerich keto. I personally think carnivore is the rock solid, most amazing, but as long as you're cooking the carbs well, you're adding the fat, you're eating 1 meal a day at night, rest and digest, right? And you're doing a little bit of my ice cream. It is a home run, by the way. CBD, we sell at CNY CBD. It should be online. I have to talk to Will about that and see where we're at with that and make sure it's going in the right direction. Is everyone doing okay? I'm going to get out of my pottery studio after this. I'm making some fertility cups. Maybe I'll have them online for you guys. I'm working on it. Keep on talking, but I'm going to do it. I'm going to do it, I promise. Let's see. Optimal progesterone, LH, and estrogen level for transfer. It's such a wide variation. The LH doesn't really matter, by the way. Are we talking about the day of transfer? But basically, if you have an LH rise, and you are going to ovulate, then we need to start progesterone or let it happen naturally. But typically, we're looking for a lining of 7 to 12 or even up to 15 to 18, by the way. And then progesterone needs to be basically under 2. Then start your progesterone. We like to see the progesterone over 20, but there's a variation to that. It can be 15 to 30 or more. And estrogen levels about 200, but we've seen 50 to 5,000. So there really is a tremendous amount of variability. It's not an easy task to keep it right on this little narrow thing because our bodies are absorbing and responding. These levels are very commonly quite variable, and people do quite fine, by the way. Pottery room at the Healing Arts. Yes. And I've been watching, I've been doing pottery for a long time. Just kind of like one of my fun things, just a slab. It doesn't take a wheel, but I love the wheel more than anything. A lot of people are getting to do their pottery and do stuff, slab work at home. Do something creative, like making masks or tie-dye stuff. And you got to have fun in this journey. Remember, we are suffering going through very hard things, but while you're suffering, do something fun and interesting and learning and creative that might take your mind off your problems and make you feel better, reducing cortisol and epinephrine, serotonin, oxytocin levels go up. I always like to put on a little Pandora, listen to some good music in the background, and that it really helps us tremendously, by the way. Yes, painting for sure. I do throw a little acrylic at the canvas from time to time. Thank you, everyone, for joining me. Now, I'm off on Friday and off on Saturday. I'm back on Sunday. And then next week, I'm going to be off probably. I might be on Monday, Tuesday, but after that, I'm going to be off for the rest of the week. And I'll get back to you guys. And But Dr. Verdialis, Dr. Faruqi, we have Aaron McCullough, Jennifer Waters. I know Allison is doing lives, our donor team. Justine is doing some things. I wish she'd get her face up there and do that too. But our whole team is really, really coming together and working hard to learn new things, bring new things to the table. Remember, if you're afraid of something and anxious, it usually means you're going in the right direction. So take that as a sign to like push you forward. And that's where we all have to get to, right? I'm afraid all day long. And especially those nurses sometimes, boy, I gotta be really careful. I gotta zip it up more than I do. But they're amazing, and I sometimes a little pushy. An email yesterday, New Beginnings. You know what you did? And I looked at it. I think you just need to sit tight and hold and not do anything. I don't think you need to do, I don't think it's blood where they said it was, but I did look at it. I apologize, and I'll look at it again tomorrow and get back to you. But I did pull it up and look at it, and I don't think there's anything to worry about. It'll all resolve, and maybe just some cyst also in and around the ovary. Wish I would found years ago. Krista, here we are today. You can't go back to yesterday. Here we found you guys today. And we remember we're all learning together. And remember, attitude brings up your altitude, right? It brings you up higher into the clouds. Some people say I live in the clouds. When I'm flying, that's where I like to be. Eve, hello. Kelly, all right. I've been talking, Morgan, hello, a lot more about starting stems day 1, 2, or 3 of your cycle, but don't do it unless someone knows about it. They got to know about it, but it's getting harder to get these scans early on, but I've been talking to Donna and the team about just saying, okay, let's talk to you ahead of your cycle. Let's get all your baseline information. Let's get your medications. And then when your cycle starts, you know when to start, you when to call, and we'll get you going from there. Low sperm count when all tests come back normal. Low sperm count when all tests. Oh, well, keto diet for sure. Get off the treadmill. LDN, Conception XR, HCG, and Clomid for guys. And then IUI or IVF for sure. But Kiltz's keto is rock solid, amazing, by the way. It's cool. All right. Soon, June 4th. Man, can you guys believe it? It's June, summertime. All this crazy COVID's going to be behind us and we're not going to know what to talk about. Babies, that's it. And remember, practice, practice, practice. That's it. All right. Rosanna Graves, all right. We look forward to you, right? Pretty quick after that, but we've got a really crazy, busy global team. Crazy. All right. God bless to all you guys. Thank you so much for being with me tonight. I really appreciate it. I'll see you guys Sunday morning, 10 a.m. for the hour fireside, but maybe I'll be outside or I'm going to try to be in my pottery studio, just hanging out there, showing some of my stuff and enjoying. God bless you guys. I'll see you guys on Sunday. Take care.